This week is National Eating Disorders Awareness Week. Nearly 29 million Americans will battle some kind of eating disorder in their lives, according to the National Eating Disorder Association. Often these begin in the teenage years or even younger, we've seen. And while we know that childhood obesity is a major concern, there is a question about how we best help our kids maintain their health and a healthy weight without causing an eating disorder inadvertently. So to talk a little bit about this, I'm joined by Dr. Anne Marie O'Melia with the Eating Recovery Center here in Denver. Based in Denver, covers multiple states though. And Anne, the American Academy of Pediatrics came out this year with some new guidance surrounding childhood obesity that's caught your attention because, among other things, it advises doctors to offer weight loss drugs to kids as young as 12 years old and even surgery for kids as young as 13 years old. Eating disorder specialists have been critical of some of these guidelines. And tell me, what do you think went wrong here? Where did the AAP perhaps err, in your opinion, in their judgment and in their new guidance?
Well, let me start by saying I'm actually a pediatrician. I'm a fellow of the American Academy of Pediatrics. I'm also a child psychiatrist, and I specialize in the treatment of eating disorders. What the American Academy of Pediatrics did right is they drew attention to the stigma that is attached to kids in larger bodies. They did a good job of talking about the complexity of obesity as a chronic condition, and that there are many factors involved in developing this chronic condition of obesity. They actually even did a good job of calling out that the word obesity can be offensive to some people.
Interesting.
But they talked well about the genetics of weight and the socio-cultural and environmental factors that go into a kid's nutritional situation and the size that they are in their body. What they didn't do a very good job of is actually guiding around the weight stigma and the potential negative consequences that can happen in a conversation with your pediatrician. So by focusing on a person's size and in fact focusing on a body mass index, or the BMI, as an indicator of health, and almost the sole indicator of health for a kid, with regard to their nutritional status, they're missing so much. There's so many other factors that need to be considered when considering a child's health, especially with regard to their nutrition, their food intake, the way that they're using their bodies for activity. And they chose to focus almost exclusively on BMI.
Interesting.
With the idea, when you focus on BMI, you're thinking, and these recommendations would reflect, that if we turn big kids or fat kids into thin kids, then they will become healthy and happy. And in truth, that's just not what happens.
So much more complex than that. Well, let me ask you then, as a pediatrician, how should parents who are concerned about their children's weight approach this subject, and how would doctors better do that?
Well, actually in 2016, not that long ago, a group of eating disorder specialized pediatricians and weight management pediatric specialists got together and they wrote guidelines for the prevention of obesity and eating disorders. They wrote those together, and in there lies some very good work. There it's focused on the kid as an individual. What is their life like? What is their relationship with food? What is their relationship with their body? What can we add into a kid's life instead of just adding in a restrictive meal plan and telling what not to do? This is about adding foods instead of taking foods away, adding fresh fruits and vegetables, adding activities, adding family meals, adding family activities, instead of trying to restrict and trying to focus on weight loss. Instead, we're focused on improving a kid's overall health and well-being.
So it is National Eating Disorder Awareness Week, and if you know someone who needs help with an eating disorder, the Eating Recovery Center in Denver offers inpatient and outpatient treatment. On their website, you can find screening tools and other information. And the National Eating Disorder Association has a toolkit for parents, teachers, coaches, and others.
Well, nearly